Hi, I'm Dr. Rudi Merck, and I am here with Claire, who is a person that's accompanied me on many videos. And when we first did videos together, Claire, you were pregnant.
Yes.
And now you've had a baby, and you've got some questions for me about nutrition and supplements, and when do you start them? So ask your question.
Yeah, so just really any general nutritional advice for starting at babies?
Yeah, for very young babies, you have to be very careful as far as supplements and dosing is concerned. And I highly recommend that you wait until the children are at least 1.5 to 2 years old before you really consider anything. Now, the thing that I would recommend are two things, and one of them is a krill oil, or a new product that I've been working on, and we're not going to mention a brand on this, on the Dr-Rudi.com, but the other one that we've been working on is herring roe oil, something that is made from herring eggs. Roe is herring eggs. And I think that at about 1.5 to 2 years old, it would be really great to put some krill oil or herring roe oil into a baby's food, just a few drops, not giving them a whole supplement. Also, I think that starting with astaxanthin at a very low concentration, in other words, you take a pin, you prick an astaxanthin, of course you have it in a towel because your hands are going to get red if you get it on your fingers, and maybe 1 drop in a baby's food. The other way you can get astaxanthin, of course, is if you get your baby to eat salmon at some point after they stop with formula and they're starting to eat solid food. And salmon is very safe. It has a low level of metals in it. Never give your baby or your growing children tuna.
No tuna.
Because there's too much mercury in it, and it's potentially could cause lack of brain development. Certainly lead and heavy metals like that are very dangerous for children. And you can give children trout, which is a fairly young fish, doesn't have any, it's a sweet freshwater fish. So there's no issues with heavy metal in trout. They're mostly farm raised. Salmon is recommended.
Oh, bless you. Oh, bless you.
What a cute thing. They start getting allergies at a very young age here in Florida.
Okay. So what can you recommend for allergies?
Yeah, the other thing I think is very important for children is ALA omega-3.
Talking.
Yeah, cutie pie.
You're talking.
ALA omega-3 is important for brain health and for the development of children. Krill oil and herring roe obviously have EPA and DHA phospholipids, but ALA is important to reduce inflammation. Now, dosing of it is very simple. Every week you grind up some almonds or some walnuts. Don't store the material that's ground. Just grind them up before you use it. Either use a spoon on spoon, you crush them, and you sprinkle a little of that in their food, and that will provide them with ALA, which is very important for brain development. And so your doctor will give you some baby vitamins, I'm sure, but also you have to make sure that they get some lutein and zeaxanthin in their food, and that would be coming from greens. So, kale.
Leafy greens.
Greens. So it would be things like kale, broccoli, and of course if you can get them used to eating that when they're very young, the chances are that when they get older they'll also do it. So the kale type foods, ALA, carotenoids, and then the standard vitamins your doctor would suggest to you for good health. Now, when children would get older, at the age of around, I would say 16, it would be really good for them to start taking adult type things. Again, a 1 a day type of vitamin with no minerals is important. You get your minerals from the food that you eat. And I would again say krill oil, herring roe oil, ALA, nuts, even peanuts are healthy at that. Now I don't recommend peanut butter. It's too caloric. There's issues with aflatoxin in peanuts, which can affect liver health. But eating peanuts, is okay. Generally, if you can have low salt peanuts, you'd be absolutely fine. So hopefully that helps you a little bit, and you have a beautiful baby boy, and his name is Theo.
Yes.
Right?
Yeah.
And one day he may be a movie star. Who knows?
Indeed.
And his first shoot was on Dr. Rudi.
Absolutely.
Right?
Thank you so much for that
Thank
advice.
you very much.
That's invaluable. Thank you, Dr. Rudi.
Okay.